We thank you for sharing with us, and we thank you for reminding us about the H in HIT. We also thank our other panelists for telling us how we can use this to improve the quality of care for everyone. So we want you to just stop for a moment and think about what you just heard. And on your sheets on your tables you have some questions. And I want you to go to the last question. Based on what you just heard, what can we do differently in our work, in our world, to use technology for patients in healthcare? I'm going to give you about 5 minutes for that, and you can address that from from all the panelists that you've heard, and then we're going to come to you and hear how and what we can do differently. Can work together on that too. Okay, we're going to get some of your answers. If we could get some microphones out in the audience. So what can we do? How can we make things better? Do we have someone here? Yeah, okay.
Hi, my name is James Shu. I'm with the Prevention Kiosk. And after I heard your very moving story, that an idea came to my mind, that is, for families of patients who are so motivated to figure out what's going on, it might be beneficial for them to get some kind of access, some kind of web-based internet-based access to the electronic medical records that exists for their loved ones. And I think that kind of access will help improve healthcare literacy, because people are going to want to understand what that lab record means, the lab results, where do they stand compared to the normal curve, and so forth.
Thank you. Yes, more? Someone else?
Hello?
Yeah.
Glenda Harbert with the ESRD Network of Texas, and thank you very much for sharing your story. What came to me is the use of the Ask Me 3 methodology, which is a teach-back methodology to assess patient and family understanding of the health information that's been given to them. It addresses health literacy, bringing information at the level of understanding, and then using 3 questions. What's the most important message in what I've heard? Why is it important to me, and what do I need to do about it, as a way of asking the patient to teach back and assuring that they understand. Then it gives the healthcare professional the opportunity to say, they didn't get it, I didn't provide the information in a way that they can understand it, so that you can continue to go back and interact and provide information until the patient family actually gets the message.
Thank you. Mike, over here, please. Right here.
First of all, your husband's care sucked. Mm-hmm. There's no even minimal standard that met, notwithstanding the fact that I think a couple federal laws were broken, and advocacy for you and your family was zero, which IT won't help. You have to have advocacy in the heart to be in healthcare in order to do healthcare well. Beyond that, the IT component of that, my background, I'm an ER doctor, which really bothers me as far as hearing your story. But I did family medicine for 9 years. And the IT component of that would have been to be able to have that email access, because usually with your primary care doctor, your family doc, or your family doc's nurse, there's that healing relationship that's ongoing. And to be able to have that, to be able to say, my husband's in hospital, possible tumor, please help me understand this, would have been a very, very good way to bring in the primary care component of this, to make sure that you have the system. And just like we heard from previous presentations here, about having what's the team, what's the support team? I believe from Frank, right? I believe that we heard from the other day. What's that team that's there to help support me, which obviously the primary care doc has the component of that. And certainly in my world, when I was in family medicine, my nurse was, she would grab me by the collar and say, get over here and answer this question. because one of our patients is down at the hospital and something's going on. So that component of IT, as far as being able to have that, being able to put that messaging out, really I think would have been able to bring some sense-making to what went on, but there's no way that you can normalize anything that happened to you. From healthcare and as a physician, I apologize to you for that because that really stunk.
Amen. Okay. Thank you. Yes. Can we have a mic over here, please? Thank you.
Just want to thank you so much for telling this story and having the courage to do this, working with a lot of patients and families. I know how psychologically traumatic it is and that it takes you a while to even rebound after this. So thank you for that gift to this group, because I know how traumatic it is to have to tell the story. That was a gifted and wonderful story. In the spirit of what this group is now embarking on, which is a journey of social entrepreneurship, what we're taught by great leaders like Dennis Wagner and others, and that teach us about social entrepreneurship, is to move fast, hit hard, and do things and make commitments and make offers. So we make the offer, as I just discussed with you on the stage, to, number one, take the video that we've shot here and fast-track edit it so it'll be made available nationally so this story can be told. Number two, you've committed to, and I ask you, that you'd be willing to work with us to produce a story for physicians entitled Remember the Holidays, so that in the first part of this next year, we can get this story out to doctors who have patients today who need to know, who are your holidays? When is this going on? Because I've been asked to do that nationally for physicians. I can't think of a better story. And the third thing is that Regina's also agreed to be in the Discovery Channel movie, the next documentary following Chasing Zero. How many of you believe that that would be a powerful story?
Okay, we're going to take one last comment, and then I'm going to give the panelists, if you want to say any closing words, we'll turn to you before we close out. Yes.
Rebecca Hightower, EQ Health in Louisiana. I seem to have a lot to say this week. And I didn't hear this specifically. No one was listening to you. No one was listening to your husband. If we don't listen to the patient, no amount of HIT is going to help us improve care. The EHR and other aspects of the electronic health record are only a tool to help us make the improvements and create the force fields and the reminders and the allergy alerts and all that, but that's not a substitute for examination and for truly listening. I'm not a physician, but I'm a nurse. And if you're asking me, if I'm working your husband's case and you're asking me, then I'm going to ask the physician to help me answer your question or to talk with you. And I've done it many times. We have to listen, because our patients can tell us exactly what they need. They're our best source of information, even when they don't understand.
Thank you. Thank you. Thank you all. Do you have any closing things you'd like to say?
I did want to say something. I did want to say something and sort of addressing you wonderful, empathetic comments here all over. Two things. One, my son is in special ed, but I don't know if you caught, he's in special ed in the District of Columbia. The District of Columbia has not the best special ed system in the United States. And one of the ways you get services within the District of Columbia is you are an advocate for your child. And that's through access to information. So if I just depended upon the system to provide him services, as they're supposed to do, and didn't advocate for him, he would still be stuck in a restrictive placement that actually restrained him. But because the law and the Freedom of Information Act and ADA is on my side, because I can go to a court of law and prove, due to access to his record, that his needs are not being met, I can change his life. And this is one of the things we need to talk about with an HIT and why HIT does not work, you're right, in a lot of cases, but it especially does not work without patient access to that information. Because if you're stuck in a bad situation where the doctors are not behaving as they should, you can't change anything without access to that data. The second point I'd like to make is, yes, if our primary care physician had taken an active role within my husband's care, our experience could have been very different. But being able to email her wouldn't necessarily have helped in this case. When we finally got transferred to another facility so my husband could get a second opinion after we fired the primary who never took an active interest in the case, I got a phone call 2 weeks later from her office where they were concerned that I might be making waves. So, yes, I am making waves, but that's not a lawsuit. What I want to do is change the system. And HIT doesn't work alone, yes, but it works with physicians and patients, facilities and information technology, all working together on an even playing field. And that's the goal.
Thank you. Brian or Kathy, any closing words?
I just think Regina did a great job of reminding us why we all do what we do each and every day. And sometimes we lose sight of the importance of the patient because we get so caught up in the technology or what all we have to do for the day. I think you gave us a great reminder of what it is we should truly be focusing on. So thank you.
Thank you.
If I just put on my hat, if I take off my Regenstrief hat and put on the hat of our organization we support most, which is the Indiana University School of Medicine, I'd just like to say that we have a lot of work to do in terms of education of future physicians. We have started a program at IU to address some of the things that you talked about in your story in terms of some very innovative, we think they're innovative things in terms of educating future physicians in terms of the patient relationship and the importance of explaining information and taking time to really walk through things with patients, especially in an oncology situation. So I would love to have you come to our place and see what we're doing and learn more from you. And I think that in our work with the double AMC, I think we can do a lot more to support education of future physicians to address some of these problems, not just with the appropriate use of HIT, but also in sharing that information and making sure you discuss it with the patient. Like Dr. Blumenthal talked about, turning the screen around and involving the patient in that conversation as data is entered and as data is graphed and shared and displayed, I think would be an amazing revelation in our system.
Okay. Well, thank you all again, the panelists, and thank you all for your participation, and we will close out this session.